Good. Good.
Dull. Sharp. Warm. Also eucalyptus. Yes.
How's this?
Sharp.
Hi, Emma.
Hi.
I'm Dr. Matt. I'm going to do your examination today. I have here your file, but it's been a long time since we saw you in the clinic. Can you please verify your date of birth for us?
Yeah. 12/01/02.
Okay. And are you taking any new medicine?
I am taking spironolactone for my acne.
How long ago were you prescribed this?
About 3 months ago.
Okay. And are you experiencing any side effects?
No.
Okay. And when was your last checkup?
A year and a half ago.
Okay. Are you experiencing any pain?
I am, yes, in my lower back and the bottom of my skull.
How would you rate the pain on a scale of 0 to 10, 10 being the worst?
I think a 4 in my lower back and a 6.
And is it constant or it comes and goes?
It comes and goes.
Okay. And are you experiencing any sharp pain? How would you describe it?
When I lean over to the right, I can feel a sharp pain in my rib cage. Yeah.
For how long has that been going on?
A couple weeks.
Okay. Are you experiencing any blurry vision?
Yes, at night.
Okay. Are you hearing any sounds that are not there, maybe?
Sometimes I hear a ringing noise, but it's not often enough where I feel like I should be concerned.
Okay. Have you noticed any changes in your smell or taste?
No.
Any metallic taste?
No, but maybe a dry mouth.
Okay. Any issues or problems with breathing? Have you noticed sometimes that you're breathing faster than normal or slower than normal?
No.
Okay. And are you experiencing any skipped beats, any palpitations?
I don't think so.
Okay. Any trouble with your stomach, any abdominal pain?
A little bit, yeah.
And is it more centered, right or left?
I feel like centered. I normally just take a Tums though when it happens.
Okay. Is it sharp or is it more dull?
Maybe a mix of the two.
Have you noticed the pain increases or decreases after food or before food?
Definitely before food.
Okay. Anything else that I didn't cover that you would like me to check for you?
I don't think so.
Okay. I'm gonna start with your blood pressure first, and then we'll do a regular checkup to make sure that we are not missing anything. I'm going to put gloves on. Are you experiencing any numbness or tingling sensation in your fingers or toes? Okay. All right, I'm gonna have you take this off for me so that I can take your blood pressure. I'm gonna use your left arm. This is going to feel pretty tight. I'm gonna have you breathe normal, just relax. blood pressure it is a little bit low. We would like the systolic to be somewhere between 110 and 125. Yours is 99. So that could explain some of the blurry vision that you're experiencing at night. Are you experiencing blurry vision right now? No. Okay. All right, I'm gonna have you look right here for me. I'm gonna shine a bright light in your eyes. Okay. I'm going to divide your field of vision. Keep on looking straight at my nose. Good. So your pupils are on and reactive to light. I'm gonna press down on your eyelid. We're checking for any discoloration. Okay. Go ahead and look up for me. Okay, normal eyeball color. Go ahead and look right here for me. Okay. Okay, no irregular eye movements. Okay, go ahead and give me a big ah. No redness, no discoloration. Okay, can you go ahead and push with your tongue inside your cheek? Good, and the other side. Okay, I'm gonna try to lift up your head. Don't let me do that. I'm gonna try to turn your head to the left. Don't let me do that. It is a little bit weaker on the side. Is that the strongest that you can do?
I think so.
Okay, what about now? Okay, a little bit stronger, that's good. Go ahead and shrug your shoulders and relax. Okay. I'm going to check your reflexes. Go ahead and relax your jaw for me, just a tad. Good. Good. Moving to the shoulders. Go ahead and relax your shoulders. Okay. Now you relax your elbow, your whole arm. Okay. Okay, we're definitely going to check your magnesium levels to see if there's any deficiency, and also your vitamin D. Okay. Okay. So the right side is definitely a little bit more responsive. Good. Okay. I'm going to listen to your heart. You can just breathe normal for this part. This is going to feel a little bit cold. I can hear S1 and S2. No S3, no S4. Go ahead and take a deep breath in through your nose. Out through your mouth. And again, breathe in. And breathe out. One more time. Slowly breathe in. And exhale. Okay, I'm going to take a look at your back. I'm going to have you turn towards the wall. I'm going to put your hair up so that we can take a look at the nape and cervical spine. Okay, so you're gonna feel my fingers starting at the base of your skull. We're palpating cervical vertebrae. We have here atlas. I'm not feeling any swelling. The tissue is soft. And it seems to be normal spaces in between atlas and axis. Looking at the curvature of the spine, some deviations might be normal. So we want to make sure that there are no signs of scoliosis or lordosis. Sometimes that type of pressure could really trigger some pain. Okay. I'm going to check your reflexes of the spinal nerves. Okay, neurologically seems to be normal, behaving within normal limits. I'm going to here listen for any microscopic movements. We're looking for any cerebrospinal fluid that might be leaking from the tubes. Slight microscopic movement can be heard at T2 and T3. Go ahead and take a deep breath in through your nose, out through your mouth, and again breathe in, breathe out. One more time, breathe in. We're checking the base of the lungs to make sure there is no respiratory infection. Okay, I'm going to check the skin turgor to make sure that the elasticity is according to where we want the hydration and nutrition levels to be. Hydration level does look within normal limits. We're checking the skin for any raised bumps We're looking for inflammation. Taking measurements of the spine from C1 to sacrum. We're looking for an imbalance. And this would indicate inflammation that we definitely need to assess. There is about a 5-degree difference from right to left when we're looking at the thoracic area. And that could definitely bring an imbalance to cervical and lumbar and explain the pain, discomfort that you're experiencing. I'm going to do sensory tests to see if there is any nerve damage or nerve constriction. You're going to feel a vibration. Let me know if you do feel it or you don't.
I feel it.
Okay, now go ahead and tell me when you don't feel it anymore.
I don't feel it. I don't feel it.
Okay. We're looking at the thoracic area, so we're gonna run a few more tests here. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp will feel like. And the other one is gonna be dull. This is what dull is gonna feel like. Go ahead and tell me if you feel less sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. 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 dull, dull, sharp, sharp, dull, sharp, sharp.
Does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
Do you feel this equally?
No.
Okay, I'm gonna use a different texture to check. Okay, go ahead and tell me you feel this on the left or right.
Right. Left. Right. Left.
Does this feel cold or warm?
Warm. Warm.
And now?
Warm. Warm. Cold. 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 Warm. 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 Warm.
Do you feel this warm all the way to the center?
Yes. Cold. Warm.
Do you feel this warm all the way to the center?
Yes.
Okay. I'm gonna have you lay down. I'm going to take a look at your head and neck as you lay down. It's going to help me understand a little bit more of the anatomy. I'm gonna start by palpating your TMJ, and then we're going to take a look at the lymph system. I'm not noticing any bulging, but on the right side it does seem to be more enlarged. Are you experiencing any tension on the left or right?
Slightly on the right.
Okay, looking at the masseter, it does seem to be a tad more developed. Okay, going to palpate behind the ears, looking for any signs of mastoiditis, swelling or tenderness. Palpating the neck region, starting with the cervical lymph nodes right above the collarbone. palpating submental lymph nodes right under the chin. Okay, can definitely palpate the salivary glands, which are normal size. I'm looking for any. We're looking for the preauricular lymph nodes right in front of the ears and postauricular lymph nodes, which are under and kind of behind the ears. Not noticing any signs of lymphadenopathy. Checking trachea for a midline position. Checking the thyroid gland for any enlargement or nodules. Palpating sinuses now. Right in between your eyebrows, we have the first set. Looking for any tenderness. Okay, tissue is soft, which is within normal limits. No edema noted. Moving down right under your eyes on each side of the nostril. Okay. I'm going to cover one nostril. Go ahead and breathe in, breathe out. I'm going to check patency over the right side as well. Breathe in, breathe out. Okay, so a little bit of obstruction on the left side. I'm going to have you take a deep breath in through your nose and out through your mouth. And let me know if you're able to identify the smell. You go with this? Okay. I'm gonna try one more. Go ahead and breathe in and breathe out. What does that smell like? Also eucalyptus. Okay. I'm going to check your taste. We have here a few flavors. This one is the control one. Can I have you open, taste, and close? Close your mouth. Okay, open. What does that taste like?
Nothing.
Okay, perfect. Okay, go ahead and open, and close, and open. Are you able to identify the taste?
It doesn't taste like anything.
Go ahead and open and close and open. And are you able to identify any specific taste for that?
No.
Okay, so definitely we need to investigate this a little bit further. I'm going to check your facial nerves. Go ahead and tell me if you feel this on the left or right.
Right. Left. Left. Right. Right. Left.
Do you feel this equally on both sides?
Yes. Yes. Yes.
Do you feel this cold or warm temperature?
Cold. Warm. Warm. Cold. Warm. Cold. Warm.
Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
Does this feel the same as this?
No.
Okay. And does this feel the same as this?
No.
Okay. Go ahead and tell me when you don't feel this vibration anymore, when it stops.
I don't feel it. I don't feel it. It stopped. It stopped. It stopped. It stopped.
Okay.
It stopped. It stopped. It stopped.
Which position here is louder for you? This or this?
2.
Position 1 or position 2?
2.
Okay. Go ahead and tell me which ear you hear a sound closer to you. Left or right?
Right.
Okay.
Left.
Okay. Tell me with which ear you hear this sound.
Right. Left. Right. Left. Both. Both. Both.
Okay. noticing a little bit of discoloration on the right side, more towards the crown. Have you noticed any itching or burning sensations lately?
Some itching, yes.
Okay. Could be from some constriction of blood vessels. Definitely want to see how extensive this is. Okay, definitely noticing a little bit of the excoriation on the right side. I'm going to go ahead and take a sample of that. First, we're going to apply a buffer to activate the cells so that we can remove them safely. Now that we activated the cells, we're just gonna have to do a manual excoriation so that we remove the cells that we want to test. Okay, we're going to send this to the lab. I'm going to take a look at your abdomen now. So first I'm just doing a visual inspection of the 4 quadrants. I'm looking for any obvious asymmetry. Okay. First, I'm going to listen to the right upper quadrant. This is going to feel a little bit cold. listening to the aortic valve. Moving to the left quadrant. Left lower quadrant. Slightly immobility on the left side. Going to do a very light palpation first, and then we're going to go into a deeper one to check for any involvement of enlargement. Okay, let me know if you feel any kind of tenderness. Checking both kidneys as well. Okay. Slight tension on the right midsection.
There's some tenderness up there.
Okay. I'm just gonna go in a little bit gentler. Okay, I'm going to check for any sensitivity on this side. Go ahead and tell me if you feel this dry or wet.
Dry. Dry. Wet. Wet. Dry. Dry. Wet. 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 Dry.
Go ahead and tell me if you feel this all the way to the midsection.
Yes. Yes.
Okay.
Yes. Yes.
Okay, I'm gonna take a few measurements of the left side. You want to compare and to see if there's any asymmetry. Even a slight asymmetry could trigger inflammation at the cellular level. About 3-degree difference on both sides, so that really is a good indication of a little bit of asymmetry. I'm going to percuss. We're looking for any abnormal sounds. Okay, very normal percussion sounds. We're going to run some more tests to see exactly why you're experiencing that tenderness on the left side. It does seem to be a little bit swollen, I would say. So we're going to run a CT of the abdomen, and we're going to know for sure if there is a need for other investigation tests. Okay, so just very gentle pressure here. We're looking for any edema, changes in temperature, something that would maybe indicate a circulatory obstruction. Okay. I am noticing a little bit of bruising. Do you remember hitting your left lower shin? Okay. It does look a little bit old, so it must have been about a week or a week and a half. Okay. I'm going to check your pedal pulses. Slightly diminished, and I'm noticing that the lower part of the feet is a little bit colder. We're going to check capillary refill. Slightly delayed, I would say about 3 seconds. Okay, I'm gonna check your reflexes. I'm gonna have you relax your leg. I'm going to lift it up from the knee. Okay, how is this? Good, okay. Okay, perfect. Okay, go ahead and leg. Now let's go on and bend and put it on top of the other one. Okay. Slightly diminished on the right side. Same thing. Okay. Left side looks good. I'm going to check your Babinski reflex. Go ahead and relax. Okay. Relax. Okay. Okay. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. Sharp.
Does this feel cold or warm?
Warm. Cold. Warm. Warm. Cold. Warm.
Do you feel this cold all the way up to the knee?
Yes.
And now?
Yes.
Do you feel this cold all the way down?
Yes.
And now?
Yes.
Okay. Do you feel this equal to this?
Yes.
And does this feel equal to this?
Yes.
And does this feel equal to this?
No.
Does this feel the same as this?
No.
Okay. Just going to listen and look for any venous stagnation. We want to make sure that there is good blood flow to the extremities. Go ahead and wiggle your toes. Okay, I'm going to move your right toe either towards you or towards me. Go ahead and tell me what you feel.
Me. You. You. Me.
Okay, I'm looking for any dryness. The skin looks intact. Checking pedal pulses one more time. I'd say slightly diminished on both sides. Okay, I'm going to check the strength and mobility here. Go ahead and push with your pads. Okay, pull. Okay, I'm going to try to bring your heels up. Don't let me do that. Okay, gonna try to open. Don't let me do that. Just slightly slightly weaker on the right side. I'm gonna try to close. Don't let me do that. Okay. I'm gonna have you stand up. I'm gonna talk about the results. Okay, one final test. I want to see your arms right there in front of you. So we're gonna look for any desynchronization between right and left. I'm gonna try to push them down. Don't let me do that. Good. Okay. Go ahead and squeeze my fingers. All right. I'm gonna try to open them now. Don't let me do that. I'm gonna try to close. Don't let me do that. Okay. Go ahead and relax. Go ahead and cover one eye. Okay. And I'm gonna have you try to touch my finger with your right index. Okay. I'm gonna do that a little bit faster now. Okay. Okay, let's go ahead and switch. Okay. Slight desynchronization on the left side. So we're going to run a few more tests before we conclude to a diagnosis. I'm going to do a CT scan of the abdomen and then an MRI of the upper neck and head, okay? Okay. The nurse outside is going to schedule you for these two tests, and then once we have the results, I'm going to get back to you with a clear prognosis and to figure out what we can do to help with your pain.
Okay, thank you.
You're welcome. Thank you for coming in.
Thank you.
See you soon.